Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. The most common and rare flu shot side effects. The flu shot is the best protection against seasonal flu. This is why millions of people get the influenza vaccine each year. According to the World Health Organization, the seasonal flu infects up to 1 billion people annually. /r/n/r/n While very few serious side effects have been reported, people have been known to experience mild flu shot side effects, as well as to the nasal spray flu vaccine, FluMist. /r/n/r/n Flu shots are produced by using inactive viruses. This means they have been killed and are not infectious. An annual flu shot offers safe and effective protection against the seasonal flu. The side effects are typically mild. They are caused by the immune response that boosts your immunity to the virus. /r/n/r/n You may feel soreness for a couple of days in the spot where you were injected with the flu vaccine. If you have side effects like low-grade fever, headache, fatigue, or muscle ache, your symptoms should go away after a day or two. /r/n/r/n Side effects may include /r/n/r/n in a positive way, yes. Research shows that getting the flu shot can lower your risk of heart attack, heart failure, and other major cardiac events during the following flu season. /r/n/r/n In very rare cases, people may have serious allergic reactions including anaphylaxis after getting the vaccine. /r/n/r/n Signs of anaphylaxis include /r/n/r/n Anaphylaxis is a medical emergency. If left untreated, it can lead to loss of consciousness, shock, coma, heart or respiratory failure, and death. /r/n/r/n This severe reaction typically occurs within 5 to 30 minutes of coming into contact with an allergy-causing substance, allergen. In some cases, symptoms may appear more than an hour later. /r/n/r/n A study from the Centers for Disease Control and Prevention, CDC, found the estimated rate of anaphylaxis after all vaccines is 1.31 cases per 1 million doses. The rate was 1.5 cases per million doses for a typical influenza vaccine. /r/n/r/n Anyone who has experienced a severe, life-threatening allergic reaction to a flu vaccine in the past should not get the vaccine again in the future. Of note, people who have had a mild allergic reaction, such as hives the next day, can and should continue to receive the annual flu vaccine. /r/n/r/n For many years, people with egg allergies avoided flu shots. This is because the vaccine was initially produced using chicken eggs, posing a potential risk for a reaction. /r/n/r/n New recombinant or cell culture-based flu vaccines are made without eggs, making them safe for people with egg allergies. They include FluBlock, for adults 18 and older, and FluSilvax, for people 6 months and older. /r/n/r/n You should tell your healthcare provider if you have an egg allergy before getting the flu shot. Still, it's important to know that this should not prevent you from getting the vaccine. /r/n/r/n The risk of an allergic response to any flu vaccine is extremely low. This includes vaccines that are egg-based. As such, the CDC recommends the vaccine even for people who have a history of egg allergies or who have had mild hives after vaccination. /r/n/r/n People with a history of severe allergic reactions to eggs can get the flu shot at their healthcare provider's office, although the CDC no longer recommends additional safety measures for people with egg allergies. The provider can watch them for signs of a reaction and manage the symptoms quickly. /r/n/r/n It's true that people with chronic health conditions are at a greater risk of complications from the flu. However, they are at no greater risk for side effects from a flu shot. Flu vaccines have been proven safe in this vulnerable population of people. /r/n/r/n On the other hand, the FluMist nasal spray vaccine is not recommended for people with certain chronic health conditions. This is due to possible complications from the weakened form of the live influenza virus. It contains ./r/n/r/n. The FluMist nasal spray is a live attenuated influenza vaccine, LAIV. This means it is made with live viruses that have been weakened. They are unable to cause influenza illness. These weakened viruses can only multiply at cooler temperatures, like those found in the nose. They cannot survive at normal body temperature. /r/n/r/n. There are some side effects specific to the FluMist nasal spray. Side effects of the nasal spray can include /r/n/r/n. There is a common misconception that the flu vaccine can give you the flu. This is not true, and neither the flu shot nor the flu nasal spray will infect you with influenza. /r/n/r/n. If you get the live attenuated vaccine, which is in the FluMist nasal spray, it's possible that you may shed the live virus for up to 11 days after being inoculated, though it's unlikely that you'll spread the virus to others. Shedding with this type of vaccine is most common in young children. /r/n/r/n. For years, there have been rumors to suggest the flu vaccine may cause autism. One of the claims is that preservatives such as thimerosal are a possible trigger for autism. /r/n/r/n. Research has shown that this is not the case. According to the CDC, thimerosal has a long history of safety. There is no evidence of harm caused by the low doses used in vaccines. /r/n/r/n. If you are concerned about preservatives in the flu vaccine, talk to your healthcare provider about other options. Most single-dose vials and pre-filled syringes do not contain a preservative. This is because the products are used right away and not shared. The same applies to the FluMist nasal vaccine, which is also preservative-free. /r/n/r/n. An annual flu vaccine is safe and effective for preventing influenza. Many people report mild side effects, like muscle aches or low-grade fever, after getting the shot or nasal spray. These side effects are normal and do not mean that the vaccine gave you the flu. They typically go away in a day or two. /r/n/r/n. Some people with allergies, notably to eggs, need to be aware of the possibility of a reaction. Recombinant vaccines are an option because they are produced differently. People who have had a severe reaction to the flu vaccine should not receive it again. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.